we're very privileged to have with us two co-authors of the book, The New Health Age. And let me start by reading a quote from The New Health Age. The New Health Age offers a succinct primer on how we got here and where we should be taking the health of our nation. And that's from Dr. Oz, who is now recognized as one of the great health people on television. And joining us today, we're very pleased to have with us Jonathan Fleece. Jonathan, thank you so much.
Good to see you, Charles.
And Futurist David Houle. David, thank you for joining us today.
My pleasure.
Well, gentlemen, what is the New Health Age?
Well, as a futurist, I'm excited about it. It is the new age of health globally and particularly in the United States of America. It is a time when we're moving to the next stage of modern medicine. It's a time for wellness. It's a time for transformation of the healthcare system. It is a great time to be alive if you're interested in health, wellness, and longevity.
And David, you've written another book as well, which is, kind of ties into, and tell us about that book, which has gotten a great reception. It's called The Shift Age.
The Shift Age, yeah. Well, the Shift Age is the age that we've moved into. We've left the information age and we've moved into the Shift Age. And the New Health Age is kind of an extension of the Shift Age. Modern medicine began back in the early stages of the Industrial Age, took us through the Information Age. Now we're in the Shift Age. And in this 21st century, the Shift Age is moving us into this century, and I think this century is going to be thought of as the new age of health.
Well, Jonathan, the question then arises, what is the state of our health? What is the state of America's health that you've put together in this book?
Yes, if you look at where we are as a country right now, we're not in great shape with respect to our health. Nearly 1/3 of all Americans are considered clinically obese. Nearly 2/3 are considered overweight. Only about 25% of Americans regularly exercise and engage in physical activity. If you add up the total number of Americans that die each year from preventable diseases that are strictly associated with their own choices, it's about 1.5, 1.6 million Americans. Almost the entire population of the city of Philadelphia die each year from diseases that they could prevent based on their own lifestyle choices. So we're not very healthy right now.
So where do we go from here? What's the next steps that you would see? David?
Well, there was a law passed in this country which basically set a new direction. And regardless as to what happens with that law, the change has already occurred. Healthcare is going to become patient-centric and primary caregiver-centric. No longer will everything be disconnected. It will be much more cohesive. In fact, there's a chapter in the book called the 80-20 chapter.
And that's probably one of the chapters that a lot of people are going to be interested in. Explain what that means.
Well, it's kind of the chapter I use in the cocktail conversation when I'm trying to describe healthcare. Health and the transformation of it. Healthcare is about 17.2% of the Americans' GDP. So rounded up to 20%. So basically, in the new health age and in the new landscape of healthcare, all of that wonderful stuff that's in the 80% of our GDP, connectivity, searchability, transfer of electronic data, all of that is just coming to healthcare. So all the wonderful stuff, all the devices we have, all the demands we have about being able to search things, all of that is coming to healthcare. So it's simply that healthcare, 20% of our GDP, is now going to get upgraded to where the 80% already is.
And a perfect example of that would be, let's look at your financial records. In today's banking system, you can be in the great state of Florida, travel to California for vacation, and if you're a banking client of a national bank, or even if you're not, you can put your ATM card into a machine, access your money, go into a bank teller's office or a branch office, access your financial information. But in today's healthcare delivery system, you can literally sometimes be across the street from one provider to another provider and not be able to easily access some of the most important information in our lives, and that's our health information. And it causes not only inefficiencies, as David just mentioned, but certainly clinical quality issues in our system today, not having that connectivity.
those positive steps result in hospitals and healthcare providers being more accountable. Where it's basically, and I think you used the example of being able to say, if you're going to look at the facts and figures on one hospital where an infection rate or is higher, you can have that data at your fingertips to make informed decisions, which I thought was a wonderful aspect of it because that's not available at this time. Is that correct?
That's exactly right. The connectivity and the accountability are two of the key things for the new health age. In other words, if you have a loved one who's sick, say perhaps has cancer, you want to be able to search and find out the people in your area that have the highest degree of success in treating that cancer. Or if you have to go in for a hospital stay, what if one hospital has a 10% infection rate and another has 5%? You're going to know that. You don't know that now. And that goes back to that 80-20 thing. Knowledge is so important, and we as consumers and we as patients, nothing is more important than our health.
Exactly.
So here we are where the most important thing, our health, we have the least information about. And to the connectivity, think of it as you will own, Charles, your medical record, and you take it with you. You own it. You don't have to ask permission from some doctor over here to ask them to fax it to somebody else. You take it with you. You are in charge of your own health.